So I've been interested in older people for many years now, and trained, as Norma said, in London in psychiatry of old age and in general adult psychiatry, but I've specialised working with older people since 1998, and certainly have learnt a great deal from them, and hopefully have been able to improve the quality of their lives when they have the misfortune to have something such as dementia. So I was asked to talk about the diagnosis of dementia, but I thought that it's maybe better to look at not only dementia, but also what else can cause memory problems. Why do people become worried about memory, and what to do when things go wrong, and where to go to for advice and what to expect. So I think the first thing to remember is that, and I found this online, the first thing to remember is that for most older people are very healthy and live well, and okay, yes, they may have some medical issues, may need to take medication, but a lot of people live independently, and the great majority of older people live well at home in the community and don't need the health services and don't need to have their memory checked out. But it is a fear for people, and a very real fear, that they will lose their memory, particularly if they've known somebody who has had a memory problem, somebody who has had dementia, that this will happen to them. And in fact, I saw a lady today, and she was telling me that she's feeling very anxious and worried because she knows that both her mother and her grandmother both had dementia, and she's very worried that she will get dementia. And this lady has no evidence of any memory problem. She's perfectly well. But among the issues we discussed was whether this would be a concern that needed to be checked out or not. But I think it's useful for people who maybe aren't familiar with the brain, just to see exactly what we're talking about. The brain has, various different parts to it that are responsible for different things. So this, to the left of the picture, is the front of our brains, and to the right is the back. And right at the back is the occipital area, which is responsible for vision, so being able to see or process visual information. And at the front is the frontal area, and that's responsible for judgment, behavior, coordination. And then we have the middle bit in the middle, which is responsible for memory and language, and the motor areas are in underneath as well. And this back bit is the back posterior part of the brain. So with dementia, then you can get difficulties in all areas of the brain. So it's not just a memory problem. And I'll come back to this picture later on. But first of all, to talk about memory and what is it. So we divide it, it's more complicated than this, but we divide it principally into three areas. Working memory, what happens in the moment when you're concentrating on what I'm saying. You're listening, you're concentrating and taking some of it in. So it's the working part of memory. And if that's not working well because of anxiety, or somebody's not concentrating, or they're distracted, or thinking about something else, then whatever the piece of information is doesn't get registered and go into short-term memory. Then short-term memory is what lasts for a short period of time. And typically a test I would do would be to ask somebody to remember 3 objects. 5 minutes later, ask them to repeat the 3 objects back. So that's a test of short-term memory. The first test is to see, can they register it? Can they remember the 3 words? And I would always ask somebody to repeat it back to me. And then see in a few minutes later, can they bring it back? Long-term memory is then what happens many years ago. And that is preserved for a very long time. And often people with this condition have good long-term memory, and I will hear that from family members, or indeed from individuals who have the illness themselves, that somebody can remember back many years, but can't remember what happened an hour ago, or will constantly ask the same question again, but can remember where they went to school, who their friends were, what happened in family events, family history, and so on. So that's just a little bit about normal memory. I mentioned earlier, people get very anxious about memory, and one of my slides, which isn't here, talks about the numbers of people with dementia, and it's quite negative because it talks about how many people will develop dementia between now and 2050 or something like that. But actually, if you look at it the other way around, only 5% of people over 65 develop dementia. So the great majority of older people don't have dementia, but it is a problem in older people, and it does get more common the older you get. It's about 1 in 5 of people over 80. But that also means that 4 out of 5 don't have dementia. So I think it's important to look at both of those things, to remember that most older people are well and living at home, and that our expectation is to live well up until for as long as possible. And of course, there are many more older people now than there would have been many years ago. The average life expectancy is much higher now than it would have been even 20 or 40 years ago. So there are many more older people. So again, I've had people say to me, but we hear so much more about dementia now. And part of it is that we talk more about it, so we know more, we understand more, and we can do more. But sorry, I got a bit distracted there. But so we can do more, but also there are bigger numbers of people. So that's why we maybe hear more about it. So one of the things one of the issues I wanted to look at was how to keep one healthy. And I can see this is, again, it's like a picture of the brain. But how do you keep your memory? What do you do to protect your brain health? How do you mind the mind? And these are all the things that I'm going to talk about for a few minutes. Just to remind people that our brain is like any other part of our body. We need to exercise, we need to keep it healthy. And mental activity, for example, is very important. So such things as doing new things, stimulating oneself, maybe whether it be doing crosswords, doing Sudoku, playing bridge, whatever takes your fancy, something to keep your brain active. Because we know that the evidence is there that I'm sure you've heard the phrase use it or lose it. So it is important to keep it active, to exercise it, and we know that there are increasing connections between our neurons in the brain if we keep mentally active. Physical activity, again, is very important. And the recommendation for heart disease is 3 times a week, 30 minutes, 3 times a week. We would say 3 to 4 times a week, and to do something that pushes you a little bit, not just a little wander, but if you can only manage a little wander, then that's fine too. But if you can push yourself a little bit, just to push the heart rate up, then that can help to preserve brain health as well. Because the healthier we are, the fitter we are, the more blood gets to the brain, and it keeps the brain healthy. Alcohol over here is. It was interesting. I was out last night for dinner with a colleague who is an expert in hepatology. He's a liver specialist, so he was talking about alcohol, and he said actually, there is no safe level. So I thought it was fairly strict. And they do say that 1 glass of red wine a day will lower the cholesterol and be good for the heart. His opinion, no, but there you go. He does take a drink himself, so he's obviously not that strict. So, but alcohol, certainly it is important to limit it. The levels would be somewhere in the region. Safe levels of drinking are recommended to be 14 units for a woman and 21 units for a man. A unit being a glass of wine. A glass of wine meaning a pub measure of wine, not the home tumbler full, And it is very important because alcohol can cause memory problems in excessive amounts. So I suppose everything in moderation. So moderating alcohol intake would be very important. Diabetes. Well, again, I'm sure you will be familiar with diabetes and the complications that can come from that, but good control of diabetes would be very important to limit any vascular changes that might happen, that might limit the risk of stroke. So if you can manage to keep to the diet, take the medication, and make sure that it's well controlled, then you're less likely to get the complications from it. Equally, high blood pressure. There's a risk of stroke with high blood pressure, so when we're at my age and older, we need to make sure that the blood pressure is controlled, that it's monitored, and that you take medication if that's what's required to keep it at a good level. I don't think I need to mention smoking. Everybody knows smoking is bad for you. It can cause all sorts of problems. It can cause heart disease, it can cause stroke, cancer, all sorts of cancers, not only lung cancer. So smoking is definitely not good for your brain. Equally, obesity of people who are very overweight. Again, this is a risk factor for stroke, so therefore it can be a risk factor for something happening to your brain. So it's important to keep a control of that. Diet. So what do they say about diet? So the good diet apparently is a Mediterranean diet. And a Mediterranean diet is one that is low in red meat. It is high in oily fish, in multicolored vegetables, so tomatoes, greens, red peppers, yellow peppers, any other vegetables, multicolored vegetables, olive oil. That's really what comprises Mediterranean diet. Again, very good for your brain, very good to keep your brain healthy. I was at a conference earlier in the year, and they were talking. I went to a whole session on brain food, and I was absolutely fascinated by some of the psychiatrists who were doing research into what food was good for your brain. And this chap has written an entire book about kale, and says that kale is very healthy for our brains and that we should be eating more of it. And he's got all sorts of recipes about what you can do with kale, because I have no idea. I've never been able to do anything with it. But apparently you can just sprinkle a bit of oil on it, put it in the oven, and you can get kale crisps, which are much healthier than the potato crisps or any other variety of potato crisp. So it's interesting that there's a lot more research going on into such things. What you eat can affect your brain. And this was not in relation only to memory, but also in relation to mood changes and depression and so on. So it's very interesting. What else do we have here? Cholesterol, again, minding one's cholesterol, getting it checked, and using diet to try and control it. Diet and exercise are the primary things that can help, but sometimes people need to take medication for it to keep it under control. And last but not least, on this slide is depression. And we know that stress can cause memory problems, and it can be a precipitant. So having a healthy lifestyle to try and prevent depression. Depression is not all preventable, but if you can do something to prevent it, so much the better for your brain health, as it were. So this is, I think, really repeating what I have said on the previous slide, keeping the brain active, novel experiences, challenging ourselves a little bit, Mediterranean diet, exercise 3 to 4 times per week, 30 minutes each, trying to push that a little bit. And the one thing that isn't on that previous slide was social engagement. And social engagement is terribly important, particularly as people get older. Sometimes, spouse can pass away, families move away, friends aren't as available. Maybe people aren't as able to get out and about because of mobility or driving or living in rural areas, in more isolated areas. But social engagement is really important for again, keeping our minds healthy, but also to prevent depression as a consequence of social isolation. Laughter, there's also evidence to show that laughter is good for our minds, and we all know that. If you're out with your friends and you have a good laugh about a few things, then you feel better. So if you can introduce laughter, movies, books, whatever, family, friends, whatever makes you tick, it can be very useful as well. I put this slide up because not so much that he was worried about his memory. This gentleman unfortunately does have dementia, but he's well known now because he's on YouTube. So I don't know if any of you have ever seen him, but this gentleman lives in a nursing home such as here, and he was very quiet and very non-communicative, and his family were worried about him, the staff were worried about him, and they wanted to see what they could do to connect. So his daughter brought in an iPod and put on his music from Jamaica, where he was originally from, and they put on this music for him, and this is all on YouTube, and you see him sitting on YouTube, sitting quietly with his head down and not speaking and not responding to anybody. They put on the iPod with the earphones and his music, and he lights up just like this picture. And they are able to communicate with him by using the music. And I think it shows that it's not only when you're healthy that you can do things to help stimulate your brain, also whenever you have the condition itself. But if any of you have access to it, if you can look it up, it's easy to find. It's worth watching. It only goes on for about 3 or 4 minutes, but it's interesting. So I better move on to talk about what you do when you have a memory problem. When to look for advice. So I mentioned earlier, whenever all of us go upstairs and forget something, or go out to the shop and forget something. So what is it when do you need to worry about it? So when it's repeated, when the recent memory is not just a once-off, it happens frequently. You notice that the short-term memory is poor, forgetting recent events, but the long-term things that have gone on in the past is preserved, is good. So it's when recent memory is poor. Particularly is when you need to look for advice is when it affects everyday life. So, for example, not keeping up with bills, not being able to do daily tasks, not remembering to buy fresh food for the fridge, not being able to manage things that you've easily managed before. Forgetting telephone calls repeatedly, forgetting appointments. I had a lady who went into town to meet friends. She forgot where she was to meet the friends, then she lost her car, and she just couldn't quite figure it out. And this was in the context of having some short-term memory loss. If the memory loss is getting worse, if you, for example, forget names of friends and not remembering, of course we all have that thing where somebody comes up and you look at them and you say, I know who it is. Hopefully nobody will come up and I won't have to introduce them because I don't know what the name is. But then it comes to you. But sometimes if you get that and it's not coming back, then that might be something that you might think would need help with. Losing the thread of what you're saying. I have somebody recently who she's finding it difficult to get the words right. And you remember that the picture of the brain, which I showed earlier, there's a part of the brain that is responsible for language. So that language center may be affected, and not being able to find the right words and not being able to concentrate on what one is saying. Getting lost on familiar journeys, perhaps. And these would all be symptoms that you should look out for. That's not to say that it's dementia, but it's something that you may need to look out for, may need to get further advice. So where do you get advice? Well, the first port of call, I think, is the general practitioner, the first person who will know you well, will know what you were like before, will be able to advise as to whether this is something that you need to be concerned about or not, or whether further opinion is necessary. A GP will have a look at the general health, blood pressure, pulse, physical health, any physical health problems there might be, might do some blood tests, and might do a very brief memory test to see if there's any particular issue. But why do you get advice? And I often get asked, well, would it not be better just to leave it? It's okay. People get confused. People lose their memories when they get older. But I think people need to know if there's something wrong, and particularly if there's something wrong that can be treated or can be reversed, or you can do something about it. But particularly because people worry, and I've had so many people over the years coming to me saying that they're afraid that they're losing their mind. And it's not losing your mind, it's a memory problem, but it's not losing their mind. And I think you can provide a lot of reassurance to somebody if they understand what's going on, what the diagnosis is, what to expect, what treatments there are available, and how to make things better. You can also you find the diagnosis, you can identify causes, particularly things that might be reversible, such as, hormone problems like thyroid, or vitamin problems like B12 deficiency or anemia, low hemoglobin. So there are certainly things that might be there that could be treated, and that this is not dementia. It's important to have a management plan then as to what will happen in the future, to understand how things will be in the future, or what people can look out for, what supports might be available to them, and so on. And of course, finally, but most importantly, it's how to live well and how to have a good quality of life. And that's why it's important to get advice about memory problems. So if one is being referred on, we'll be referred on to perhaps a memory clinic, or perhaps somebody like myself who's a consultant psychiatrist working with older people. I actually run a small memory clinic in the hospital with my colleague, Dr. O'Donovan. So we do see people who want to have their memory checked out. And there are other memory clinics. Nationally, there are memory clinics almost all over the country at this point, though it's patchy, it's not well spread out yet, and not well funded by the HSE either. The other person that you might get referred to is medicine for the elderly, physicians who work with older people as opposed to psychiatrists. So what would you expect if you came to see me, for example, with a memory problem? Well, you'd expect to see me in my office, you'd expect about an hour of an appointment, and what would I do? Or what would somebody like me do? Well, you would certainly talk to the individual, talk to them about their worries, talk to them about their concerns, talk about any other factors that might be present. Is there any anxiety, for example, or is there any depression? How are they functioning on a day-to-day basis? Any difficulties that there might be at home, any difficulties there might be with family members, any stressors that they might have had, any physical or medical problems, if there are recent surgery, any recent hospitalizations for treatment of any infections, for example. And I would also look back at past medical history, or whether there was any other previous medical problems, whether there were previous psychiatric problems, previous history of depression, for example. I would look at the background, and part of it is to understand more about the person. And people sometimes look at me as whenever I ask about childhood and growing up and what did they do for a living and marriages and family and so on. Part of it is to understand more about the person, and part of it is testing long-term memory. Can people remember what's been going on? And then I would move on to look at examining memory and seeing if there was any other, as I said, if somebody was depressed or anxious or had any other form of mental illness. And then we would look in a more detailed fashion at memory. And these two tests, the MMSE or the MOCA, are two of the most common tools that we use. They're both 30 questions long, and one is more detailed than the other. But they look at things like, does one know the day, the month, the year, and everybody will know all of that. The short-term memory I mentioned, maybe remembering a couple of objects for a few minutes, looking at concentration to see if people can concentrate, because if concentration is poor, then that might be significant. We would look at coordination and whether the frontal part of the brain, which I showed you earlier, whether that's working properly, coordination and planning. Do a test of language to see whether people have any language problems. So it all adds up. It's not a diagnostic test in itself, but it gives an idea to me as a clinician whether there is something to be worried about or not. And if somebody scores 30 out of 30 on either of these, you know, you'll be fairly sure that everything is reasonably okay. Having said all of that, I would still go on to do blood tests, for example, to look at hormone imbalance, vitamins, liver function, renal function, kidney function, routine blood count. We do all the routine blood tests to make sure there's nothing else going on. We might or might not do a chest x-ray. If somebody is a smoker, I probably would. I might do an ECG if I was considering treatment, just to see how the heart is and how things, if there's any abnormality there. And very importantly, I would always speak with a family member, because I would always ask if somebody's coming to me with a worry about their memory, that they bring a family member with them, because they will be able to tell me, are they worried? Have they any concerns about the problem? So the individual may have concerns, but the family member have no concerns. And of course, we often have it the other way around as well. So the family member has concerns, but the individual has no concerns. But it's to try and marry those up, and you get more information as to what is going on and how people are functioning at home, for example. Are there any difficulties that the family member would bring to my attention? I may or may not, if I felt that there was a memory problem, it would be almost routine now to do what we call neuroimaging, or take a picture of the brain, which would, in essence, take a picture like the one you saw there, but it also takes pictures going this way as opposed to this way, front to back, sideways, so you can see, is there any shrinkage in the brain? Is there anything like a brain tumor? Which wouldn't often present with just a memory problem in itself in any case. But is there any evidence of any strokes or any bleeds or anything like that? And it's almost routine now, whereas whenever I was first appointed in '98 to Limerick, trying to get a CT scan was like trying to get blood out of a stone. So, but these days it's much easier and much better. We can do that fairly routinely in the Dublin hospitals, and certainly nationally as well. For some people, and not everybody, but for some people where there may be a doubt about it, and I'm not sure whether we're dealing with a real problem or not, I may refer to a neuropsychologist or a clinical psychologist to do more detailed testing. So I mentioned up above the MMSE and the MOCA. That's a very brief tool. I can do an MMSE in 3 minutes or 5 max. So, but what my colleagues do takes about 3 hours and 2 sessions. So 2 by 3 hours, 6 hours testing, and then they put it all together. And they look at various aspects of cognitive function. They look at memory, look at language, look at coordination, look at planning, look at numerical accuracy, look at writing, all sorts of parts of the brain that they test in detail. And then we can put it together with everything that goes above. So unfortunately, there is no one test. You can't go and get a blood test to say that'll tell you what it is. You can't go and get a scan and that'll say. You can have a normal scan and still have a problem. So it is a combination of all of these things. It's what we call a clinical diagnosis. So unfortunately, there isn't one test that one can do. So I've mentioned how we do our cognitive assessment, the orientation, memory, and so on. I would say just at the bottom, these are standardized tests. So if I use the MMS here, and my colleague in London uses the same one, we'll come out with the same thing in the same individual. So it's standardized across. But I don't get too hung up on scores either. It is, as I said, you have to put together everything, not just the numbers that come out at the end. So you can't come out, and I'm always telling my trainees, you can't come up and tell me, well, they scored 23, so therefore there's something. I'm saying, no, there isn't. You must take into account everything else that I mentioned. And these are some of the other causes of memory loss. So the psychological, I've mentioned anxiety and depression and stress, and sometimes people can come across as having a memory problem with severe depression, but when the depression is treated, the memory gets better. So that's one of the things that in my area of expertise that I would be looking for. There are medical causes, so we can have what we call an acute memory problem, acute delirium, acute confusional state, if you like. And we all know, our children, when they're very small with a very high temperature, can be confused or appear confused, and that's a delirium. And that also happens in older people. Those are the two common places where you see it. Young children and older people. Can be from infections, urinary tract infection, can be a bowel problem, constipation, can be any medical illness. The list is like this long, or medications. So very important I didn't mention that actually when I was talking about the history, very important to look at medications. Any change in medication that has happened recently, particularly there are some sedative medications that can knock memory, knock concentration, and people can come across as being confused when they're not. Again, I've mentioned some of those. So if we come to having a memory problem, then what possibly could be, if we've outruled all the reversible causes, all the medical causes and the anxiety and depression. So the first thing that it might be is mild cognitive impairment. So this, if you like, is like before one ever gets dementia, but it doesn't mean that one is going to get dementia either. So mild cognitive impairment could be with somebody, or so-called MCI. Somebody who's worried about their short-term memory may actually have some short-term memory loss on objective testing, but they're functioning well and they can manage it. So I had somebody recently, and he uses his iPhone, he uses reminders, he uses, to help him through the day. And I'm not convinced that he has a real memory problem, but, people can function very well with this and keep going and don't need any treatment, don't need any medication, but this needs to be monitored to see whether it progresses or not. So we normally just keep an eye on things. The worry could be either the individual and or the family. Sometimes the family is worried, but not the individual. Usually there's with the MCI, and to have MCI, there's no impairment of functioning, driving, daily tasks. There's no problem with any of that. So just to briefly talk about the early symptoms of dementia, and the one thing that everybody thinks about is memory, but in fact, it does cover a lot of other areas of our cognition as well. So it could be somebody has short-term memory loss, they may have language difficulties, it may be difficult to learn things, to learn new things, such as an iPad or a computer or a new cooker, or something that is something that they haven't seen before. There may be very poor motivation, not being interested in doing things as they were before. And this can be difficult to tease out with depression, and that's where we have to be very careful that we're not putting one thing down to, for example, a cognitive problem, but in fact is depression and needs treatment. It can be difficulty in reasoning, difficulty in judgment, not being aware of, putting themselves in a situation, for example, driving, whenever they maybe have got lost a few times and should really realize that maybe driving is not such a good idea, particularly at night or in unfamiliar areas. So these are all early symptoms of dementia. And if those occur, that it's worth getting it checked out. So this is another of the slides I used last year when I was talking about this subject, because I think just to comment on dementia, that it is an umbrella term. Dementia is the whole thing. It's all dementias. So sometimes people will say to me, well, is it dementia or is it Alzheimer's? But dementia is the whole thing, it's all of the umbrella. But the most common type of dementia is Alzheimer's disease, as described by Alois Alzheimer. And at that time it was described in a lady who was in her 50s. And it was, as years went on, people realized, or physicians realized, that in fact this was the same pathology as what was happening in older people. And it was described then as Alzheimer's disease. So we now talk about early onset when people develop Alzheimer's under the age of 65, and late onset when it's after 65. We then have, if you can imagine, a couple of the sections of the umbrella, the less common types. So vascular dementia, which is caused by mini strokes, if you like, to the brain, not getting enough blood to various areas of the brain, which then can cause memory loss or other problems with cognition. Lewy body dementia is another form of dementia, frontotemporal, and there are many more, which can cause various problems. So I mentioned before about management and why as one of the reasons why you would go and see about your memory, or why one would go and see what can be done. Because there are things that can be done, and we know this, that it's not like many years ago when people would have said, oh well, there you go, Granny's a bit confused in the corner, we'll just leave her to it. Do you know, it's not like that now. There is we know much more, we're much more able to manage it, and we can help people to live well with dementia, and that's the aim, I think. So the first off, I suppose, is medication, and the medication that can help the memory are so-called cholinesterase inhibitors, and they act on a particular neurotransmitter or brain messenger that we know is lacking, and this can to up the level of this brain messenger to help the memory or to stop the disease from progressing as quickly. It doesn't reverse the disease, it doesn't, cure it, but it is an effective medication in some people. Not in all people, but in some people. And as I say to people, people would say to me, well, if it was your mother, would you put her on it? And I would put, if she needed something like that, because I think it is effective and can make a difference. There's another type of medication called memantine, which works on a different brain messenger, and it can also be useful. I think it's important to manage any medical issues, because any medical issues can make things worse, can make the confusion worse, can make memory worse in somebody who has dementia. All the bit I talked about at the beginning, the minding the mind, that relates to people who have this condition as well. As per my gentleman with the music, it can all help. And as Norma will tell you here, that everything you can do to stimulate somebody within reason, that you can give people activities that they can manage, it does help people to have a better quality of life. I think we also need to provide education or help people to understand what's happening. I think it must be very frightening, and I try to do it sometimes, to imagine what it must be like to wake up in the morning and forget what you've done the night before, or not to know what's happened. Say you're doing something during the day and you forget what's happened earlier in the day, and try to put yourself into that situation, that very confusing world. And it's to try and provide an understanding for people and to help them with managing that. And for family members to understand as well what's going on and how they can help somebody with the condition. Memory assistance, there are certainly aids and tips that we can give people that will help. There's certain cognitive therapy which can help, cognitive stimulation therapy which can help with memory loss in the early stages. Again, I say living well, and social supports, keeping people active within the community. And I know in this area we have the Living Well with Dementia. I don't see Eilish here. No, not here, no. So we have a Living Well with Dementia consortium within the community in this area, and they do all sorts of wonderful things for people who are living at home with dementia and their family members. One of my favourites is that they set up a choir for people with dementia, and they sing a couple of times a week or whatever it is. And it is, it's great to have that locally. So I'm going to finish it there and take any questions. I found this poem recently, and I think it's nice because I think it resonates with what it must be like for somebody who has dementia. So I have dementia, my eyes do see, my ears do hear. I am still me, so let's be clear. My memory may fade, my walk may slow. I am me inside. Don't let me go. Thank you.